Doc2Dock was the first commitment ever made at CGI in 2005 by Dr. Bruce Cherish, our founder. So we are a very active member of CGI, and this is the 7th year we've been here. My name's Keri Geiger. I'm the president and CEO of Doc2Dock, and we provide hospitals in the developing world with much needed medical supplies. The way that we procure our supplies is U.S. hospitals throw away thousands and thousands of tons of hospital supplies every year. These supplies are not used. They are sterile, they are in their packaging, and they are thrown out for regulatory reasons. So what we do is we collect these unused supplies, hospitals donate them to Doc2Dock, and then that's how we basically get supplies to the developing world at a very low cost. We can ship those to hospitals for $25,000, and the value of those is usually about $500,000. So because the supplies are donated, we just pay for the shipping costs. We've done shipments to 16 countries in Africa, and we've done 2 shipments to Haiti. We typically have worked with small family foundations that will sponsor containers to send to hospitals, usually places that they've picked out, and that can be anywhere from Benin to Kenya. We've sent shipments to Mali. So we like to think that we help empower doctors to not only diagnose their patients, but treat their patients. You know, these are trained physicians working in very difficult conditions, and we give them the tools to actually be a doctor and to become leaders of their communities that way. Right now we're focusing on doing more regional-wide, larger impact projects where we send multiple containers to a larger area so we can really see how much impact that has on the health communities of these areas. You know, we think even if we just deliver one container to a hospital and that is the only container we're able to deliver to them, we've been able to, you know, provide so much health care with those supplies and that you know, people always say, well, that's not a sustainable model, but there's a lot of life that gets sustained with the delivery of even just one container. So we like to just see that, you know, continued year after year. Yesterday I attended the Congo Action Network, and it was a group of CGI members. There was probably about 60 people in the room, and each one of us had 30 seconds to stand up and say what we were doing in the Congo and what our interest was in the Congo. A hospital that needed supplies, hospital in the Congo, and they needed supplies, so we were able to discuss, you know, how we would actually work on something like that. And there was, you know, several conversations in the room like that. So I think it's really good because in those smaller, more informal sessions, you really kind of get a good idea of what people are doing and how your projects can synergize with other people's projects.